Hello, welcome to my X account, My Dental Hell. I'm on a journey to get my teeth fixed. I have a lot of issues. I'm going to go over everything with you guys. As you can see here, I lost tooth number 14. I had a lot of swelling and infection, and they tried to do a root canal, but it failed. And as you can see, number 13 is right next to the sinus floor. That's your sinuses right there where that white line is. And when they started the root canal, they did something, sent me home early, and I had blood and water gushing out of my nose, my left nostril, when I got home. And everybody told me I had a sinus perforation. Most people did, that I got the second opinions on, except for the dentist that did it. I couldn't get it fixed because I needed money. I needed to get a cone beam CT. I needed to get bone graft material, which I can't afford. I also possibly needed a retreat. So it was either pull the tooth, put bone graft material in there, or retreat the tooth and try to seal it up. I didn't have money for that, any of that stuff. So as you can see, now what else we're dealing with right here is right here. It's right next to the nerve, and basically bacteria got in there. Now we're causing an issue up here. So that needs a root canal, and I'm starting to have a lot of issues with that as well. Um, and there's another X-ray of this tooth right here, which is next to that tooth, which is possibly another root canal that I need to have looked at by endodontists. Now, when I go to these endodontists, they all want, I don't know if anybody realizes, but they called cone beam CT scans. They're fairly new. They've only been out for a couple years. And now when you go to an endodontist, they're making everybody pay for one. And they're anywhere between, they don't use just the x-ray alone anymore. And they're anywhere between $250 to $450. Okay? And I spent all my money on just one. And now I'm trying to go to another one to get this thing fixed, and they want another 450. They won't use that CT scan. They want me to pay for another one. I don't have the money. And this other place said they'll fix it, but I need to get their CT scan. So I just don't have the money. And basically, let's look at the tooth number. This is a tooth right here, number 13. Number 13, you can see here on this picture, there's a crack that goes from the tooth all the way up past the gum line. And as you can see here, there's a hole at the bottom of the tooth. Now, when they sent me home, this is a place that drilled into my sinuses. I could see the post at the bottom of the tooth. Now, this is right before I had the crown put on. I took a picture of my tooth. He never sealed this. He never put another post in because I think the post fell out. Also, right here is a crack that goes past the gum line. So I went to another place and I showed him this picture, and I'll show you what he sent me. So he's recommending here, his recommendations, patients to get a consultation with OS, which is an oral surgeon. If subjective findings are correct, the best plan of action would be an extraction of tooth number 13 along with a bone grafting plus membrane to allow for closure of any possible openings. So I heard that I can go to an endodontist as well, and there's some things they could do with a microscope, right? I can't afford that. I prefer that route than to remove the tooth, because once the tooth is removed, you have to replace it with something else. And that could be extremely costly. And eating without a tooth here or here will be extremely difficult. Okay? And just think about this for a second. Every time I drink water, the water gets through here. He told me it was coming through this margin right here because there's like a crack. And I showed you in the picture that crack, which goes past the gum line, right? So the water gets through here, up into the sinuses, and it causes a sinus headache almost every single day. I've had multitudes of sinus infections, I've been going through hell for over a year, and I need this fixed. And I'm begging people out there, please help me. Anything will help. This whole getting all these teeth fixed is probably going to cost me over $6,000. But you know what? Everything helps. It's only going to help me get closer to my goal, and the money that I do get, even if it doesn't cover the whole procedure, it can cover an appointment and maybe a CT scan or something. And I just pray for help, and I need help. And look here, I have an issue here. I have some crown issues as well that I need to get addressed. I have issues with crowns, and this all happened basically overnight. It's just like I was gonna move out of town, and then overnight, right before I moved, my face swelled up. Had to go get this pulled. Ever since then, I've been going through hell, and it's just like it just I couldn't progress in life because all these dental problems that were holding me back. And all I'm asking, if you have the means, if you can help somebody, you would be helping somebody that's suffering a lot. I mean, can you imagine every time you drink water having it get trapped in your sinuses and the pain, and you can't get help because you don't have money? I mean, I thought that I could go like to a doctor and a doctor could do something, but it's all dental stuff. When it comes to dental stuff, if you don't have money, you're in trouble. And that's where I'm at right now. I don't have money, and it's something I'm dealing with. And if you can help, I have my Cash App down below. If you need my PayPal, let me know. I'll post my email there as well, so you can email me. I can give you my PayPal, and any amount of money will help and will be greatly appreciated. If you have any questions whatsoever, please feel free to ask. Thank you for watching my video, and have a great day.